100 times a year? Yeah, you're cooking, right. It's common. Young women are not without risk. So, just after Mrs. Betts tells you that there won't be any exam, we're going to do a little quiz all together. How about this? So let's go with the first question. More women die each year in Canada from breast cancer than from heart disease. Is that true or false? Obesity is a risk factor for heart disease, particularly the type that shows around the waist. What is that? So was that the beep of true? This is powerful. Early changes of heart disease can be seen in the heart vessels, the coronary arteries, as early as the teenage years. Okay. It seems that the true has a beep. This is getting eerie. Every woman who suffers a heart attack has chest pains as her main symptom. That's quite amazing. Women tend to delay seeking medical help, calling 911 or going to the emergency room compared to men. I think I'm going to go home early. So this is now a fire alarm. Multivitamins can prevent heart disease in women. Are you sure? This is a very educated group. The risk of having heart disease increases with each risk factor. High blood pressure, and higher risk if you have high cholesterol in addition to that. Smoking. Well, you all have 100%. Today, we will run for our lives if this happens to be something. But I think we have time. I think we have time for a little chat before. So we'll discuss the main differences between men and women with heart disease. We'll review the current recommendations for primary prevention. And there's primary prevention, do you know what I mean? The medical world has a way to stratify or to categorize prevention. If nothing heart-wise has ever happened to you, and we want to prevent the first event, we call it primary prevention. After somebody has a heart attack and we want to prevent a second one, we call it secondary prevention. So we're going to talk about, because here we're talking about heart wellness, we'll talk a little bit about disease as well. And we'll establish an action plan to stay heart healthy. So this was, do you remember this? Did you ever see this? This was 2003. Women in heart disease. 1 out of 3 women will die of heart disease. What can you do to protect yourself? So this was part of a campaign that was to tell women exactly what you do know, that cardiovascular diseases, by that we mean heart disease, cerebral vascular disease, so strokes, hypertensive heart disease, and peripheral vascular disease, narrowing of the arteries in the legs. All the cardiovascular diseases account for 43% of deaths. And you were right, breast cancer is at 4%. Lung cancer surpassing, lung cancer in women, that's on the rise, of course. And all the other causes. So cardiovascular disease take most, a large proportion of women's lives. So breast cancer, 1 of 27 women will die of breast cancer, and nearly 1 out of every 2 women will die of cardiovascular disease. So that includes the high blood pressure induced stroke at age 92. That includes the heart attack, like Madame Leclerc at age 42, and everything in between. What's a little disturbing is over the years, you see this, I don't have a pointer, I don't think there's a pointer, but over the years, the mortality, the chance of dying from a heart attack or heart disease altogether has been going down in men. But you see, and that's the red line, but you see for women, it's kind of plateaued. We haven't, in fact, the more women, in thousands, more women than men die of cardiovascular disease. So what is coronary disease? Well, it's a disease of the coronary arteries, the arteries that feed the heart. The heart doesn't get enough blood flow, oxygen being one of the main things that it needs. And coronary disease, it develops over years. It doesn't happen overnight. It develops over decades, and I'll show you. And we call it atherosclerosis. It's a sclerosis. It's a pathological phenomenon that occurs in the arteries, so athero arteries. The arteries harden. The elderly, you know, like my grandmother used to call it, in those days it was called hardening of the arteries. And you remember this? And actually my mother too, like in those, you know, up until maybe 30 years ago, that's what was mostly called. And then we got away from it. And I'm sorry I'm ignoring you totally on this side. I'll do better. We got away from calling it hardening of the arteries, but that's really what it is. And there's fat, there's cholesterol, there's all kinds of substances that accumulate in the walls of the arteries to create blockages. So your doctor might call it plaque, might call it stenosis. And blockages result in less blood flow. There's less, it's just like in the regular plumbing. If it's partially blocked, there's less flow. If there's less flow, there's less oxygen going to the heart. The heart suffers, and the only signal it can send is some discomfort or feeling unwell. That's called angina, or a heart attack when the artery blocks completely and the heart, that part of the heart, starts dying until blood flow is restored. So what you see here is an artery, and I have something to show you. Excuse me for Rogers. I have something for you to pass around, and it's kind of the representation of this. There you go. I don't carry this every day. Don't worry about me. I don't tend to have this every day in my purse. So that's an artery. That's a coronary artery. Mine are not that big. A normal coronary artery is, at the beginning of it, it looks like the branches of a tree, you'll see, is about 3 millimeters, and then goes down in size as it gives branches, just like a tree. So this portion here is the coronary artery. And with time, you see that even from the first decades of life, teenage years, as you said, the very, very beginning of what will become plaque starts. And then it grows over years. But what happens suddenly is sometimes the plaque, this narrowing, ruptures. And what happens when we cut ourselves? What happens right away? What makes us stop bleeding? This little blood clot that forms, right? And if you scrape it off, what happens? It bleeds again until it forms another clot. If it forms a big clot in the artery, can you see what's happening? I don't think I pulled on anything. Perhaps we have to plug it in. So if the artery blocks completely, forms a clot, what happens to the blood flow to the area of the heart that needs that blood flow? It doesn't have enough oxygen, and if you're lucky, it creates symptoms. It gives the person chest pain, and we'll see that in women it can give something else. So I'll pass this around. You're welcome to. I'd like to have it back if you don't. And it's made of plastic, so don't worry. I'm going to keep on going because, as my husband would say, I'm fine talking, you know, with or without visual support. So there we are. Where are we? So are we back? No. So. Oh yes. Well, it would have been good to plug in. We'll plug ourselves back in. All right. We'll go back to what is more visual, the arteries, because I'm sure we'll get the power back. Hopefully we have something to plug it in. But we'll talk about risk factors. Do you know what we mean by risk factors? Okay. if I drive my car and I talk on the cell phone, does my risk of having an accident increase or not? Yes. So talking on the cell phone is a risk factor for having a car accident. If I talk on the phone and at the same time I'm on the Queensway and at the same time I apply mascara, all right? I don't know how I do that, but anyways. So would applying mascara while driving a car be a risk factor? Right. What do we know for risk factors for heart? What do you know is linked to heart? Smoking, big one. Nutrition, yes. What about nutrition? Bad nutrition, outcome. Take me further than nutrition. Fats, then what? Fats where? Around the waist. And that increases what? The fat around the waist. If somebody has a significant tummy, I know the cholesterol is increased. Blood pressure goes up, because we know that, because you lose 5 pounds and your blood pressure goes down, your cholesterol goes down. All right? What are other risk factors? Big, big one. Smoking we talked about. No, bigger than that. It starts with a D. Diabetes. Diabetes. Did you ever hear that heart disease tends to start 10 years later in women? Did you ever hear that? We see a lot more 42-year-old men than we see 42-year-old women. We see a lot more men than premenopausal women at their age. And we used to say that estrogens protect us so that heart disease tends to start 10 years later. So we thought menopause was protective, and we thought hormones would be protective. And we thought if we take hormones in menopause, if we take hormone replacement, that should decrease our risk. So we know that menopause is also a risk. But diabetes, of them all, is probably the worst. And a woman who's diabetic, instead of having the same risk of a man 10 years older than her, a diabetic woman has the same risk as a man. And it's even a worse risk factor in women than it is in men. So what do we have? We have weight, we have cholesterol, we have diabetes, we have smoking. What are we missing? Stress, yes. Lifestyle, yes. But one of the big ones, up there with diabetes, with cholesterol, and they often go together. There's probably somebody who takes pills for that. Doesn't cause any symptoms. It scares doctors, doesn't scare patients as much. High blood pressure, yes, bravo. High blood pressure. So the major modifiable risk factors, what do we mean by modify? It doesn't mean it's easy, but I can change it. Smoking, I can quit. High blood pressure, cholesterol, diabetes, I can control. Can't quite cure it, get rid of it, but I can control it. What else? So we talked about stress, absolutely.